my name is Laura Bass. I'm a registered nurse. I've been a nurse for over 20 years, and I'm here today to talk about some of the changes in Medicare and how they reimburse hospitals and how ultimately that can impact Medicare recipients and their bills. One of the provisions of the Affordable Care Act involves short inpatient stays. Medicare has set a 2-midnight benchmark for inpatient stays, that they should be at least 2 midnights or greater. So this is what they call the 2-midnight rule in inpatient certification. What CMS, or the Centers for Medicare Services, expect from hospitals is that they will utilize their utilization review processes to make sure that the appropriate level of care is ordered on admit, either inpatient if the physician expects that the stay will be greater than 2 midnights, or the patient should be an outpatient. So how do you think that that might impact you as a Medicare recipient?
Well, I'm wondering about whether or not it would change how much I have to put into my hospital stay.
Yes, you're absolutely right. That's exactly what that Medicare recipients are concerned about, because Part A, you have a copay, a flat copay for inpatient stays. For Part B, you can have a daily copay, and then you have to worry about self-administered medications. Medicare has designated most medications for outpatients or observation patients to be considered self-administered. So you would need to have someone bring those from home for you to give yourself. Otherwise, if the hospital administers those medications, you may be charged for those with no help from Medicare to pay for those meds. So it can definitely impact the patient's bill.
Does that include insulin and injections? And
it does. If anything that can be given at home, if it's an injection you were already receiving at home, then you have to bring it to the hospital and administer it from your own supplies rather than being supplied by the hospital.
So in other words, I would have to bring all my medicines with me.
Yes.
For them to look at, or in case I need to take them, because I'm not going to be there for an indefinite.
Absolutely. I would always recommend, if you have to go to the hospital, that you bring all your medications with you regardless, so that they can be identified. And then if you, in the case that you're admitted for observation, which is a type of outpatient admission, you would be able to self-administer those medications.
Oh, good.
So that's a very good idea. So what is CMS looking for when they review an inpatient chart? There are some stays that are less than 2 midnights that Medicare will approve. There are some surgeries that are considered inpatient-only surgeries, and there's also stays where the patient gets better quicker than expected. But what Medicare expects is that there is a certification by the physician of the need for an inpatient stay at the time of admit. Okay? And this is from the Center for Medicare Services, their Medicare Learning provider publication, to say that along with what's in the medical record, they're looking for a certification or an attestation from the physician that these services are reasonable and necessary. The way hospitals are approaching this to make sure they have a sufficient documentation is using their EMR, leveraging that technology. One example is when the physician, this is an electronic order system, and Epic is the vendor for this. This is a button that the physician chooses, and then he has to confirm that, yes, I am attesting that I expect this inpatient stay to last greater than 2 midnights, and that the medical record documentation will support this certification. So that's very important, that the physician is saying on the front end, I'm expecting this patient to be here greater than 2 midnights, or they're here for an inpatient-only procedure. Then the medical decision-making should be documented in the medical record, what led them to that decision. And we're definitely at the hospital level doing education with physicians. So why is that important to patients? And I think you touched on this a few minutes ago, that your financial liability is different under Part B, Medicare, which pays outpatient claims, and then under Part A, which pays inpatient claims. So it's very important for you, for your doctor, to document correctly and for the hospital to bill correctly, so that you're not out of pocket more money than necessary.
Yeah, because I had Part A, and then when I was eligible for Part B, they let me know, but I had to pay for it. So
That's
not
right.
everybody I know has Part B.
That's right. A lot, Part A you receive as part of your Social Security benefit, but Part B is something that you have to pay for. And a lot of people don't have the money to pay for Part B. So when that status is changed to an outpatient stay or an observation stay, it can have a huge financial impact on that patient. So it's very important that if you're a Medicare recipient or you have a family member that's being admitted with Medicare, that if you're admitted to the hospital, that you ask specifically, are you being admitted as an inpatient or are you observation or outpatient? And these are some of the reasons why.